Okay, so today we're going over lipid lowering drugs. We're starting off with apolipoproteins or apolipoproteins, which consist of A1 and A2. They remove lipids from tissues and return them to the liver. Also consists of B100, which delivers cholesterol and triglycerides to non-hepatic tissues. These are consisting of very low density lipoproteins, VLDLs, which carry mainly triglycerides to non-hepatic tissues and have apolipoprotein B100s. They allow VLDLs or very low density lipoproteins to bind to cell receptors and transfer lipid content to the cells, may contribute to atherosclerosis. Low density lipoproteins, or LDLs, carry cholesterol to non-hepatic tissues, have apolipoprotein B100s, and allow LDLs to bind to cell receptors and transfer lipid contents to the cells. LDLs are formed from VLDL remnants. They are known as bad cholesterol and contribute to atherosclerosis. They compose 60 to 70% of total cholesterol. High-density lipoproteins, or HDL, have apolipoprotein A-1 or A-2 and A-1 or A-1 and A-2. They can also carry A-4. They carry cholesterol from non-hepatic tissues back to the liver. They're known as good cholesterol and carry cholesterol back to the liver. Composed of 20 to 30% of total cholesterol. The apolipoproteins, which remove lipids from the tissues and return them to the liver, are A1s and A2s. Cholesterol screenings, so for men over 35 and women over 45, or people 20 to 35 with risk factor for ASCVD. Fasting lipid panel is what we want to do. This measures total cholesterol, LDL levels, HDL, and triglycerides. Desirable cholesterol is going to be anything less than 200, LDLs less than 100, HDLs more than 40 for men, and more than 50 for women. TGs, or triglycerides, we want less than 150. An optimal lipid panel would have an HDL above 50 milligrams in women. Therapeutic lifestyle changes. So cholesterol, we want that less than 200 a day, 200 milligrams a day. Saturated fats, less than 7% of caloric intake. Avoid alcohol and keep carbohydrate intake 50 to 60% of caloric intake to lower triglycerides. Fiber, 10 to 25 grams a day. Plant stanols and sterols. Exercise 30 to 60 minutes on most days to increase HDLs and decrease LDLs. The time you do it is more important than the intensity of it. You want to quit smoking and lose weight. Diets with large amounts of carbohydrates and alcohol will initially increase which of the following? LDLs and blood sugars. Lipid-lowering drugs, they all decrease LDLs and triglycerides and elevate HDLs. The first goal is to reduce LDLs and raise HDLs. And these are done by HMG-CoA reductase inhibitors or statins, bile acid sequestrants, and ezetimibe or Zetia. Second goal is to reduce triglycerides, and you do this with fibric acid derivatives or fibrates. HMG-CoA reductase inhibitors, statins, that's our first slide for our drugs. The suffix for these is statin. The uses for these, they're the most effective drugs for lowering LDL and total cholesterol. They also raise HDL. Advantages, they have very few side effects. Examples of these are atorvastatin, lovastatin, lovastatin, pitavastatin, pravastatin, rosuvastatin, and simvastatin. So they all have statin at the end. Mechanism of action for these HMG-CoA reductase inhibitors or statins is they inhibit HMG-CoA reductase, which decreases cholesterol synthesis in the evening. Liver overcomes by increasing production of enzymes. This increase in the number of LDL receptors in liver, which removes LDL from bloodstream if genetically capable. This also decreases the production of apolipoprotein B100, which decreases production of VLDLs. This promotes blood vessel health and decreases inflammation. It also dilates vessels, stabilizes plaque, inhibits platelet aggregation and calcification, and decreases thrombin synthesis. HMG-CoA reductase inhibitors pharmacokinetics for statins. It is most effective if given in the evening. Because of metabolism, there is a large first pass effect. CYP3A4 metabolism for the following drugs: atorvastatin, fluvastatin, lovastatin, and simvastatin. Excretion is primarily done in the bile, and drugs with significant renal excretion are lovastatin, pitavastatin, pravastatin, and simvastatin. The hepatotoxicity for statins is going to be 0.5 to 2% if treated for greater than or equal to a year. And these will be some of the symptoms. You'll have anorexia, nausea, vomiting, jaundice, elevated liver function tests or LFTs. Stop if LFTs rise to 3 times the upper limit of normal. Monitor LFTs before treatment and give as indicated, and avoid alcohol. The myopathy for statins, so mild injury is 5 to 10%, and you will receive muscle ache, tenderness, or weakness. Myositis, which is muscle inflammation, with increased creatine kinase or CK, and you may have elevated potassium levels. You want to check CK prior to treatment and if muscle pain or weakness is happening. Stop if CK rises to 10 times the upper limit of normal ULN. And free myoglobin or severe muscle pain, because this is an indicator of microscopic tissue damage. Rhabdomyolysis may occur, which is muscle deterioration with renal failure, more common with rosuvastatin or Crestor. HMG-CoA reductase inhibitors contraindications and cautions for statins. So for contraindications, we have alcohol or viral hepatitis, or alcoholic or viral hepatitis, pregnancy, category X, lactation, possibly unsafe, cholesterol needed for cell membrane synthesis and hormone production. Cautions for statins is going to be excessive alcohol intake or fatty liver disease. You want to reduce rosuvastatin or Crestor doses in Asians because of double levels. If severe renal disease, avoid renally excreted statins. May be associated with new onset diabetes and cataracts. Now we're doing drug-to-drug interactions for statins. So we have CYP3A4 inhibitors may increase serum levels of statins using CYP3A4 pathway. Some examples of this are atorvastatin, lovastatin, and simvastatin. CYP3A4 inhibitors include macrolide antibiotics, azole, antifungal drugs, HIV protease inhibitors, amiodarone, cyclosporine, and grapefruit juice. Fibrates increase risk of myopathy, liver injury, and kidney disease. Also risk with ezetimibe or Zetia. Nursing implications of statins. You want to take it in the evening. Monitor LFTs, CK if muscle pain. Notify primary care provider of muscle pain or tenderness. It is harmful to a fetus so do not take it during pregnancy. Check for drug interactions when added with another drug. Grapefruit juice increases statin blood levels. Which of the following statements is true about HG? Oh, hold on. Which of the following? Which of the following statements is true about HMG-CoA reductase inhibitors or statins? It's that CYP3A4 inhibitors may substantially increase the blood levels of some statins. Patients taking a statin, lovastatin, should have periodic liver function tests. Your patient is being prescribed a statin, lovastatin. Patient teaching should include contacting the health provider immediately for severe muscle pain. Bile acid sequestrants, their mechanism of action is they bind with bile acids in the intestines and prevent their reabsorption. The liver needs LDLs to make more bile acids. The liver increases the number of LDL receptors if genetically capable, and an increased uptake of LDLs by the liver decreases serum levels of LDLs. The drug is not absorbed, it is excreted in feces. Bile acid sequestrants adverse effects. There's no systemic effect. It's not absorbed. Local effects are constipation and is the major complaint. Bloating, indigestion, and nausea, so give it with meals. Granules and powders rarely decrease uptake of vitamins A, D, E, and K. Cholestyramine or questrin and cholestyramine. You may need vitamin supplements for A, D, E, and K because of the decreased uptake. Bile acid sequestrants, drug-to-drug interactions. They may bind other drugs and form insoluble complexes with thiazide diuretics, digoxin, warfarin, and some antibiotics such as tetracyclines. You can take the medication 1 hour before or 4 hours after the bile acid sequestrants. Bile acid sequestrant of choice is going to be Colcivelum. This is a tablet. It causes less constipation, flatulence, bloating, or cramping. There's no reduction in absorption of vitamins A, D, E, and K. No significant binding to other drugs such as statins, digoxin, and warfarin. Helps control blood sugars in type 2 diabetes, and it is safe for pregnancy, but safety is unknown for lactation. Nursing implications of bile acid sequestrants: avoid irritation and impactation. Mix granules in powders in water, juice, soup, or watery fruit. Take tablets with food and water. May need fiber, fluids, and mild laxative. Granules and powders may require vitamin supplements of A, D, E, and K. You want to take medications 1 hour before or 4 hours after a sequestrant. Bile acid sequestrants lower LDLs. By binding with bile acids and preventing their reabsorption. Ezetimibe or Zetia, the mechanism of action for this is it blocks cholesterol absorption by cells on the brush border of the small intestines, dietary and biliary sources. It also decreases total cholesterol, LDL, and triglycerides, apolipoprotein B, and is a small increase in HDL. No evidence improves CV outcomes or cardiovascular outcomes. Uses for this are used with statin intolerant clients, rarely added to statins to reduce LDLs. Adverse effects for ezetimibe is going to be, or Zetia is going to be myopathy, rhabdomyolysis, pancreatitis, hepatitis, and thrombocytopenia. Contraindications are going to be active liver disease or increased LFTs. Pregnancy category is C, unknown safety during lactation. Drug-to-drug interactions for ezetimibe is going to be statins or HMG-CoA reductase inhibitors. It may increase risk of liver damage and myopathy. Fibric acid derivatives or fibrates may increase biliary cholesterol, causing gallstones, so it is not recommended. And bile acid sequestrants may decrease absorption of Zetia. Zetia or ezetimibe lowers LDLs by which of the following actions? And it prevents the uptake of dietary and biliary cholesterol by the brush border. Fibric acid derivatives or fibrates, examples are gemfibrozil or Lipid, fenofibrate or Tricor, or fenofibric acid, which is Trilipix. Mechanism of action for these is going to be it activates liver and brown fat receptors, which accelerate clearance of VLDLs and triglycerides. It increases HDL by increasing apolipoproteins A1 and A2. This is the most effective drug for lowering triglycerides. No proof of decreased mortality from ASCVD, and it is highly protein bound. Adverse effects for fibrates or fibric acid derivatives. The adverse effects are GI disturbances and gallstones, increased biliary cholesterol, myopathy, muscle tendon. For myopathy, there's muscle tenderness, weakness and pain, and liver injury and increased liver pancreatic cancer. Contraindications are liver or kidney failure or gallbladder disease. If you're a child, pregnancy category C, so there is unknown safety with lactation. Fibric acid derivatives, fibrates, drug-to-drug interactions. There is increased bleeding with warfarin. Displaces warfarin from plasma albumin, and you'll see a bleeding of gums and bruising. Monitor the PT and INR levels on the patient. Significant increase risk of myopathy with statins, and bile acid sequestrants interfere with absorption of fibrates. Nursing implications of fibrates or fibric acid derivatives. You want to monitor symptoms, the symptoms of gallstones, which could be fat intolerance, right upper quadrant tenderness and bloating. Symptoms of myopathy, which could be muscle tenderness or pain and weakness. Increased bleeding due to displacement of warfarin, and myopathy with associated statin use. Laboratory monitoring, we want to monitor LFTs and at baseline and periodically. We also want to monitor the INR and PT levels. Which of the following drug classifications used alone increases the risk of gallstones? That would be fibrates. Monoclonal antibodies such as alirocumab, Praluent, and evolocumab or Repatha are used for high LDL levels. They are administered subcutaneously every 2 weeks. Vasculitis, rash, and urticaria requiring hospitalization has been noted with use of these drugs. Omega-3 fatty acids found in cold water or fatty fish. This is eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA. And this can be found in tuna, salmon, herring, halibut, mackerel, and trout. They reduce platelet aggregation and decrease incidence of dysrhythmias after MI or heart failure. Lovasa is EPA and DHA. It is less environmental contaminants, has less environmental contaminants than fish. You want to take 4 grams daily dose. And that will complete the first set for this lecture.